Dr. Deb Schreibman here. What's healthy? We are. I wanted to talk to you today about bioidentical hormone replacement therapy. This is something that we do when our patients come in and say to us, hey, Dr. Deb, I'm gaining weight and no matter what I do, I cannot lose the weight. Or I'm having these horrible hot flashes. And for any of you who have had a hot flash, you know what I'm talking about. It's like you are burning up from the inside. You have this volcano and it's just frying you from the inside out. So what we want to do is balance our hormones better, because when they're out of balance, they cause things like fatigue, inability to sleep, waking up at night, weight gain, headaches. It causes us to be moody. So we might be talking to our husbands or our friends and we're like, rah! And you don't even know why you're acting like that because you've had an incredibly good day. So let's talk a little bit about bioidentical hormone replacement therapy. Traditionally, we would use what we call hormone replacement therapy, and that was coming from things like horse urine, and we were seeing lots and lots of side effects from it, and it was causing things like breast cancer for both men and women, because I know a lot of you men out there don't realize it, but you can also go through this thing called andropause, which is kind of like the male version of menopause. But what we do is we use these plant-based products to make bioidentical hormone replacement therapy. You can find them in the form of pellets, shots, troches. I find that we use troches more in our office than anything, because when you use a pellet, you can stick it in somebody's butt. Sometimes they come out because the body thinks, ooh, that's something foreign. It's not supposed to be there. Oftentimes, what happens is we get a higher dose of these hormones, so we might feel good immediately, but as they start to titrate down and you get, a month goes by and 2 months go by, we start to feel bad again. When you take a troche every single day, we can control better how much hormone you are actually getting. And in my office, we actually test our patients again in 6 months to see what it looks like. So they've been taking a testosterone, 1 gram testosterone troche for 6 weeks. They're due for their next round at 8 weeks. Well, why don't we go ahead and take a look and see, how is it working for this person? Is it enough? Is it bringing their testosterone levels up enough? Or is it too much? Are we so high that we're getting too much of whatever the troche is? So I really like troches because we could do it every other day, we can change the dosage, and we can really help our patients feel better faster and monitor them better. So bioidentical hormone replacement therapy is a fantastic way to go. You don't have to just start gaining weight and keep gaining weight, being tired, losing our hair, being grumpy, and worrying about whether our marriages are going to make it through this menopause or perimenopause session, times in our life. And we all really need to go through this, and it's a great way to go through it happier and healthier and stronger. We often find that when you have a hormone imbalance, you might also have an imbalance with thyroid, with pancreas. We might have blood sugar issues, insulin resistance, all kinds of other things. So when a patient comes to me and says, hey, Dr. Deb, these are the symptoms that I'm experiencing, I say, well, let's do the right tests so that we can figure out what is going on with you and we can fix you once and for all, instead of just another diet or another Weight Watchers or joining another gym. We can actually look at the whole person, fix it, find the true underlying cause of the problem, and really help you start to feel better so you can feel like the old you. And that's what a lot of my patients will tell me is, I just want to feel like the old me. I'm sick of being like this. I want to be a good mom and a good wife and a good friend and a good doctor and a good employee or a good boss. And this is a really great way to do it. I do have a couple of questions. One is from Jennifer, and it says, are bioidentical hormones safer than standard hormones? Absolutely, because they are plant-based. So what happens is we tend to find fewer side effects when it's coming from a much more natural source than something like horse urine. So Jennifer, that is actually a really good question, and I know a lot of people don't know the difference between bioidentical hormone replacement therapy and hormone replacement therapy. So yes, if you can get BHRT, bioidentical hormone replacement therapy, that is definitely the way to go. Mike asks, how quickly does it work? When will I start to feel better? Mike, that's a really good question, and that is going to be different for everybody. And that is why in our office, we start to give you a hormone, and then we will retest you in 6 weeks because we want to see how that hormone is working for you. Everybody's body is different. It could be that you have high blood sugar. It could be you have thyroid disease, you're hypothyroid, hyperthyroid. You could have Hashimoto's. There's a million different things that could be going on with you that could be impacting your hormones. You could have a ton of stress going on. I know a lot of us have a ton of stress going on right now. So, stress is one of the greatest sabotagers of our health that there is. So, how quickly will it work? That kind of depends. And that, again, like I said, that's why we're going to retest in 6 weeks so we can see if we need to raise the dose for you, if we need to add another hormone for you. And when will I start to feel better? That also depends on the person. When I started taking BHRT, I felt good, honestly, day one. Now, when I retested in 6 weeks, I was not where I needed to be, but I was so low that little bit of help over those 6 weeks really made a difference in my life. Now, I have changed the dose, I have retested, and I am perfect, and I feel fantastic most of the time. So that will really depend on you as a person. So that's a really excellent question. We're going to start to move on and talk about vitamin B12 shots. I love talking about vitamin B12. I think that a lot of people in our world are really affected by our B vitamins in particular. And if you are deficient in B vitamins, you can have any number of symptoms. You could be exhausted. You could have brain fog. Brain fog is a big, huge one. And the thing about B vitamins is in the conservative, conventional approach to health, our medical doctors will test us and they'll say, oh, well, let's just take a blood draw and we'll test B12. Well, that's a great way to do it. But you know what? You might get a B12 number and your doctor say to you, hey, your B12 is perfect. You're 750. And you're going to say to the doctor, well, then doc, why am I so exhausted? Why do I have so much brain fog? Why do I have so many memory issues? And when you take a functional approach to your health, what I would say to you is, it looks like you're consuming plenty of B12. Now let's look a little bit further, a little bit deeper and see, is your body actually able to break down that B12? Do you have the enzymes to break down that B12 so then your body can use those B vitamins? So when you blood test for B12, you see, do you have B12 in your body, in your bloodstream, or do you not have it? It may be the fact that you're just not consuming enough B12. We give you some B12 and you do great. But in the case that your B12 is normal, then we want to dig deeper and say, okay, let's look and see if your body can break down your B12 and use it. And a lot of times that's what we find with our patients is that you're getting the B12 or you're getting your B vitamins, but you can't break it down and use it. You don't have the enzyme. How do we know that? We do a homocysteine test or we do a DNA test. The DNA test will actually tell us if you are genetically capable of breaking down B vitamins. We can do that with D vitamins as well, vitamin D3. Or do we just have an issue with not just getting that B12, but we want to get a methylated B12 into you, a broken down B12. So your body doesn't have to break it down. It's already broken down for you, and then you can use it. Guess what happens when we give you a B12 or a B complex that's already methylated, already broken down, so your body can use it? You get energy, you sleep better, that brain fog that has just been overcoming you goes away, and you can remember things so much better. So B12 is a really cool topic, and talking about all your B vitamins is a really cool thing because it gives you a lot of insight into how you are feeling. I've got a couple of questions on this one as well. Let's talk about how B12 deficiency and vegans. A lot of our vegans are doing great, right? Because they're not eating meat, not eating fish, and a lot of them maybe not eating eggs or dairy. But if you're not getting your vitamins in And if you don't have a way to break them down, it doesn't matter if you're vegan or if you eat meat, you're not going to be able to use those B vitamins and get the benefit of the B vitamins. And it really has a lot to do with brain function, memory fog, memory issues, and energy in particular. So if you're exhausted and no matter what you do and you're taking B vitamins, it might be worth doing a couple of those extra tests and figuring out if you're just having a hard time breaking those down. We do have all different levels of B12 shots right here in the office. We have B12 shots for people who just aren't getting enough B12 in, because you have to go through your gut if you're taking a B12 orally, and sometimes our guts are screwed up. So you might be taking enough B12, but it can't get through all the muck and gawk that's in your gut. And so if you take it intramuscularly through an injection, you will be good to go. Your body will be able to use it because you have the enzymes to break it down. If you're like a lot of the population and you don't have those enzymes to break it down, then you can come in and we can give you a Super Plus shot that's already methylated for you. It doesn't have to go through your gut. We'll go right intramuscularly and you will be good to go. I think I have a couple of questions about B12 that have just come in. Phoebe is asking, is it true that the older I get, the less B12 my body can absorb? I would say age absolutely has something to do with it. And I think it's because as we start to get older, we eat less. We're not as hungry as we were, so we may be not getting in as many of those B vitamins as we would have when we were eating younger, bigger portions, lots more veggies. And so it's important to take it as a methylated oral vitamin or as a shot as we age. So that is a really, really great question. I got another one here from Danny. It says, can vitamin B12 capsules help me at all? I think I've talked a little bit about this. Capsules absolutely can help you. They do have to go through the gut. So if you have a good clean gut and you're eating healthy, those will help you. If you have the enzymes to break it down, you'll be golden. You can just take a really good B12. You can take B12 sublingual as drops under your tongue. We know when we do it sublingual, it actually absorbs better than if we do it through the gut. Or you can do it, like I said, through a shot intramuscularly in your butt or your arm. And I will tell you, they do not hurt. And you might feel a little prick or a little sting for 1 second. So if you're afraid of shots, like I am, and I used to pass out when I would get shots, B12 shots are really pretty good because you can hardly feel them, but then you feel the effects of them right away. I also want to tell you, because a lot of people forget to tell you this when you go get a B12 shot, you might taste B vitamins in your mouth right away, and you might pee red. So if you pee red and you just had a B12 shot, don't think necessarily that you have a kidney stone or that, oh my God, something's wrong, I'm peeing red. B12 is red. So you could pee red and go, oh, or pee pink and go, oh, and then remember that you took a B12 shot. And that's probably the culprit of why you're peeing red. So Danny, that was an excellent question. I hope that I have answered that well for you. I did want to give a shout out to Chiropractic. We are celebrating our 125-year anniversary of Chiropractic, which I think is pretty amazing since I am a chiropractor and I have seen so many lives changed with Chiropractic. Dee Palmer started Chiropractic in 1895. It's a pretty cool story how it happened. A janitor was cleaning and had just mentioned to Dee Palmer that he couldn't hear, and Dee Palmer threw him down, I think probably on the floor, maybe on a table at the school, and adjusted him, and very quickly this janitor was able to hear again. Now, does this happen all the time? No. Most people come to chiropractors now because something hurts them. Their neck hurts them. Their low back hurts them. They have sciatica. For whatever reason, you go to a chiropractor. Chiropractic works. We have 125 years behind us showing that chiropractic works. It works for incredible things other than pain, like boosting the immune system, because when we do a chiropractic adjustment, it really is impacting the central nervous system, which then can impact all the other systems in our body, like our musculoskeletal system, our genitourinary system, our respiratory system. Right now, our immune system is, a hot topic that everybody is talking about. But you hear cases about how women, everything is right for them. They just can't get pregnant. They start to get adjusted and boom, all of a sudden they get pregnant. And it's because the nerve was compressed somewhere. And by coming and getting these adjustments, it took the pressure off of the nerve and it allowed that reproductive system to work the right way so that they could be healthy. I do have a couple of questions here about the popping noises that you hear. The popping noises and the cracking noises that you hear through chiropractic care is the release of the gases from the joints. It's not actually the bones moving. There are lots and lots of techniques that different chiropractors use. So if you can't stand that popping noise, you don't have to go to a chiropractor that does that popping noise, or you just tell them, hey doc, getting my adjustments and hearing, or getting my neck adjusted and hearing that popping noise or that cracking noise really scares me. A lot of times if you realize it's actually just the gases being released from the joints, you're okay with it. Or we could use what's called an activator, or we could use an adjusting tool that doesn't torque your neck. We do that a lot for children. We do that a lot for people who have had surgery or have had failed surgery and still want to come back for chiropractic care to see if they can get some better relief. We use an activator. So there's tons of different ways that we can do it. We have a drop table, which is just gentle drops. We can use kinesiology. So all you have to do is just make sure that you have a conversation with your chiropractor so they know if you've had a bad experience, if you've had a good experience, what worked for you, what didn't work for you. And a really great chiropractor is going to say thank you for that information and really be excited to be able to help you the way you're used to being helped, or for whatever works for you. Here at Lake Pointe Chiropractic and Wellness Center, here at Lake Pointe Wellness Center, we have an incredible team of professionals. We can do massage therapy, we can do neuromuscular therapy, we can do all kinds of different massage techniques, Reiki. We can do all kinds of things like acupuncture, chiropractic care. We do just B12 shots. We do IV therapy, vitamin IV therapy, which is really incredible for times like now where there's so much sickness out there. It gives you a big boost. We know most people walking around are dehydrated for whatever reason they're dehydrated. We could really work hard to help you feel better. We do chiropractic adjustments. We do functional medicine, or the functional approach to health. So we have a really cool team. We all work together. And in my world, I always feel like more heads, more brains are better than one brain. We work together for your health. So we do have a question from Sarah. Can chiropractic care help improve brain-body communication? Absolutely. Because our central nervous system is our brain, our spinal cord, and the nerves coming off of it. So if you have a bone that's out of place, it puts pressure on the spinal cord or nerve, and the signal that goes out that tells your heart to beat, or your foot to take a step forward, or your lungs to expand so that you can take a good breath could be compromised. And chiropractic care, what we do is find those issues. We put the bones back where they belong, and then guess what happens to the signal? It goes through smoothly, and then guess what happens to the action? You can take a good breath, you can take a step forward, pain goes away, and yes, that's a pretty great question. So that brain is connected to everything. So it's important to take really good care of your brain. Brain health, there's a brain axis, gut axis that we worry about because we know the immune system lives here. So keep your immune system and your gut healthy. Keep that brain healthy as long as you can, and you will feel fantastic. I had one more question from Olivia. How can I do things at home to help with my chiropractor is doing when I visit her for my low back pain? So what I usually do with my patients when they have low back pain is we do kinesio taping. We teach you exercises and stretches to do at home. You can purchase a TENS unit or an ultrasound unit that you could use at home. We teach you how to do that. We teach you all kinds of different things that you can do at home, because in my opinion, a really good chiropractor, takes good care of you and sees you a lot in the beginning, but as your body heals, which is what our goal is, for you to heal, you see us less and less until you get to the point, and usually about once a month, so you come in for your tune-up, so that we keep you from getting sick, from hurting, from going backwards, and keeping you really healthy moving forward. I hear a lot of people say, Dr. Deb, I came in to see you because my neck was hurting or my low back was hurting, but what I realized was I didn't have any allergies that year. Or I came to you for one thing and I realized the swelling in my legs went away. So it's pretty incredible how chiropractic works. We've been around for 125 years. I know right now chiropractors are working really hard to take some of the stress off of the hospitals, because our poor doctors, our MDs, our nurses are working so hard. They're sending us patients who have headaches and pain, because we can do x-rays and evaluations and help you so you don't have to go to the hospital where all the COVID patients are, the coronavirus is, so that we can keep you healthier, safer, longer. So I hope this helps you. If you want to contact us, please don't hesitate. FeelBetter at lakepointewellnesscenter.com. Is a great way to reach us. You can call us at 770-974-5215 or feelbetterhere.com. Hope you are well, and until next time, love and light, health and happiness. Bye-bye.